You might think the first thing to break down in a tactical athlete's body is the knees, right? Or like the shoulders.
Oh, absolutely. That's the common assumption.
Right. But today, we are doing a deep dive into this hidden epidemic that is just systematically destroying the hips of U.S. Marines and Navy personnel. It's this condition called FAI, and our mission today is to really uncover how elite military training combined with biology and culture just collides to systematically destroy the hip joint.
Yeah, it really is a perfect storm. And, to understand how a highly treatable, totally manageable condition becomes a career-ending disability, we first need to look at the unique mechanical trauma these service members endure.
Okay, let's unpack this. FAI basically involves abnormal, painful bone contact in the hip. Now, in the general civilian population, the prevalence of this is, around 3%?
Right, it's pretty low. But in the military, the burden is just massive. I mean, USMC injury rates sit at an astounding 4,418 per 1,000 Marines.
Wait, over 4,000 per 1,000? That math doesn't even sound right.
I know, it sounds impossible until you realize that they aren't just getting hurt once.
Oh, they get injured multiple times.
Exactly. The injury rate is so high, it basically equates to more than 4 hip injuries recorded over time for every single Marine.
That is staggering.
Mm.
And looking at the numbers here, it is hitting female Marines exceptionally hard. Like, hip injuries make up to 37.1% of their training injuries.
Yeah, and compare that to a maximum of just 2.1% for male.
Wait, 37% for women versus 2% for men. That is a massive gap. Why is this hating female Marines so disproportionately?
Well, it fundamentally comes down to structural biomechanics under load. When you put heavy weight on a female frame, differences in pelvic structure mean the joint absorbs force differently.
Right, so the angles change the impact.
Exactly. And you combine that with standard issue gear that isn't perfectly tailored to their bodies, and the joint just takes a massive unequal beating.
Let me visualize this. Imagine the hip joint is a perfectly fitted ball and socket. Now, imagine a slight bump on that ball.
Okay, right.
So when a Marine marches, say, with a 30-kilogram rucksack, that bump acts less like a smooth joint and more like a mortar and pestle, just aggressively grinding away the cartilage. But is this damage purely from heavy lifting, or is there a structural predisposition?
Well, what's fascinating here is that many young men and women naturally have that slightly altered bone shape. It's a small bump known as cam morphology.
Okay, so it's actually common.
Right.
Yeah.
But genetics aren't the dominant driver of this epidemic. It is the occupational environment. The relentless high-impact running with flexed hips is what actively turns those asymptomatic, slightly different bone shapes into severe structural damage.
So the environment is essentially pulling the trigger on the anatomy.
Yes, exactly. But mechanical stress is really only half the equation. The severity of the damage is ultimately sealed by military culture.
Ah, right. Because Marines are immersed in a culture of toughing it out. They systematically delay seeking care because nobody wants to look weak.
Right. Precisely. And because of that delay, military patients show up to the doctor with significantly worse joint space narrowing than civilians do.
Meaning less cartilage left.
Yeah, we're talking 3.8 millimeters of joint space remaining versus 4.2 millimeters in civilian controls.
Wow. So what does this all mean? They'd eventually get surgery, so does that just fix it?
You would hope so, but the reality is incredibly sobering. Only 39% of those who get hip arthroscopy actually return to full, unrestricted duty.
Only 39%. That's terrible.
It gets worse. Crucially, if a patient has a comorbid psychiatric diagnosis like anxiety or PTSD, that return-to-duty rate plummets to just 10%.
10%? I mean, that is barely anyone.
It's a devastating drop. Whether treated with surgery or physical therapy, a third of FAI patients are medically separated within 2 years as the joint rapidly develops an osteoarthritis phenotype.
Basically fast-forwarding the clock, so a young Marine gets an 80-year-old's arthritis. So why should you, the listener, care? This deep dive illustrates a universal truth. A culture that rewards ignoring early warning signs, compounded by poor sleep and high stress, will inevitably turn a treatable issue into a permanent disability.
Yeah, and it raises a critical question for all of us. If an institutional culture of no excuses and toughing it out directly results in permanent joint destruction and massive personnel losses, how must we redefine true resilience in other high-stress environments?
That completely flips the script on what it means to be tough. Because it turns out the bone doesn't break down until a culture of pushing through grinds it away. Something for you to mull over the next time you're tempted to just ignore the pain and push through.